According to the Yale School of Public Health, based on comparisons between those who did and did not have healthcare during the COVID-19 pandemic, from the start of the pandemic in the US to March of 2022, preventable deaths amounted to 338,594 people. My name is Jackson. I'm a Danish and American citizen who has seen what a privatized and universal healthcare system looks like. Being a human being means that at one point or another, you will end up needing medical attention. Whether that's because you're sick, because you got in a car accident, because you let your buddies convince you to jump off of that ledge on a bird scooter you rented, or because you're pregnant and about to give birth, you will at some point end up in the hospital. When that time comes, for many of us, our first thoughts are, will my insurance cover this, or will I be able to financially recover from this at all? In this speech, I'm going to go over what free healthcare looks like compared to our current privatized system, how we can address the concerns about free healthcare, and the benefits as a society we can have with free healthcare. Many people have a misinformed or biased view of what free healthcare looks like in comparison to our own. So let's get a solid view of what our current privatized system looks like compared to others. Hospitals and the healthcare systems in other nations are not the chaotic, understaffed, overpriced, and overwhelmed establishments that we see in the United States. While the United States spends more on healthcare than any other high-income country, the nation often performs worse on measures of health and healthcare. Why must we pay more to get less? Despite having 30 million people with diabetes, around 2/3 the number of cases of all the other 37 nations in the Developed Nation League combined, the US still charges nearly 10 times the amount for insulin than any other nation. That's $98.70 in the US compared with $8.81 in the other 32 non-US OECD countries. In addition to this, in 2022, there were approximately 22 maternal deaths for every 100,000 live births in the United States, far above rates for other high-income countries. In addition to that grim fact, U.S. women are also the least likely to have supports such as home visits and guaranteed paid time off during these critical times. The quality of healthcare in this nation is truly far below that of many, if not all, other developed nations in the world. The system we have clearly does not meet the needs of the people in this country. So why do we continue to run on a private system, and more so, why do we continue to fight against implementing a universal healthcare system in this nation? Let's address some of the valid concerns about implementing universal healthcare. The biggest and most heard concern about implementing universal healthcare in the US is the increase on taxes and the amount of taxes that other nations with free healthcare pay. While it is true that taxes are high in those nations, as I previously stated, the US spends more on healthcare than any other nation. You would essentially be trading your already high insurance bill for a tax increase that on average is less than your current bill. Another major concern is a decrease in quality of care. However, the reality is that when you have free access to healthcare universally, you aren't afraid to go in for that cough and catch something that's been bothering you that would have required far more attention down the line. Therefore, reducing the load on hospitals and allowing doctors more time and focus on each individual patient. When people receive preventative care, such as immunizations and cancer screenings, they have far better health and lower healthcare costs. Limited provider choice is another concern that some people have voiced. While provider choice may be more limited in some ways, just because there is a universal healthcare system does not necessarily mean that it's single payer. In Germany, patients have the freedom to choose their healthcare providers, including doctors, hospitals, specialists within the public or private system. Vanquishing some of the major concerns that people have about universal healthcare is the biggest step in creating space for it in this nation. But what does universal healthcare really do for us as a society? Universal healthcare does not only allow us to provide doctor's visits to everyone in this nation, but it provides economic and social benefits as well. When it comes to economic benefits, universal healthcare can create a healthier society, creating a more productive workforce and healthier kids that learn better and help reduce poverty. In September of 2015, 267 eminent economists signed the Economist Declaration on UHC, which showed that the economic returns on investing in universal healthcare were more than 10 times the cost. Universal healthcare also reduces social inequities. By providing for everyone, it helps to foster the understanding that the health of the citizen is the health of the society. Having free, universal healthcare for all is a sign that the government and society cares about the people within it, therefore building a stronger community and society as a whole. Overall, universal healthcare is an important step towards the future. Let's go over what was said in this speech. Now you know what free healthcare looks like compared to our private system, how we can address the concerns about free healthcare, and the benefits as a society we can have with free healthcare. Healthcare shouldn't be something that we are afraid to search out. Too many people die every year from preventable diseases because they did not seek out healthcare sooner in fear of what it may cost them. We are a modern nation whose people fear they will not be able to financially recover from something as trivial as an emergency ride to the hospital. Let's come together today and find a way to provide all the healthcare they need and want. Thank you.